Hi, my name is Shaza Abbas and I would like to welcome you to the online course in Research Ethics designed for investigators planning and conducting research in human subjects. This first module is intended to introduce you to the basic concepts of research ethics, the importance of research ethics, recognizing how research ethics guidelines have evolved, and identify what makes research ethical. We know that research has produced significant achievement in the development of new drugs, devices, and techniques, and most of this research was conducted in volunteering human subjects. Thus, there should be a system to protect these humans involved in research. Before we go further, we need to define what is research. And research is defined as a systematic investigation designed to produce generalizable knowledge. Two loaded words are systematic and generalizable. We know that research has to be done following established criteria or ways to produce valid, reliable results. That has to be done in a systematic way. And the more generalizable the knowledge produced from the results, the more valuable is the research. For example, investigations that produce less generalizable results, and these include case study and quality assurance surveys done to evaluate program. In many regulations, these are not considered or considered as non-research activities because they do not produce generalizable knowledge. As stated earlier, volunteer research subjects are used for the purpose of obtaining research-based knowledge, and thus respect for their dignity and autonomy is important. Embedded in every research experiment in humans is balancing two values. On one hand is the advancement of science and state of being without any boundary. This goal of advancement of science has to be balanced against the protection of research subject welfare and rights. However, during the history of human experimentation, many times the goals of advancing science have dominated the goals of protecting human subjects. An ethical struggle in clinical research is that few individuals are asked to accept the burdens and risks of research in order to benefit others and the society. And concern could arise here because of possibility of exploitation or abuse of human subjects involved in research. Before the 19th century, research was largely small-scale, intimate, and therapeutic in intent. For example, if you look at the journal trial, when he first tested smallpox vaccine, he tested that on his son and on neighborhood children. Furthermore, drugs followed about 17 drugs in various doses to record their properties. There was some quotation about history of research ethics at that time. For example, Moses instructed colleagues always to treat patients as ends in themselves, not merely as means for learning the truth. And Bernard wrote in his introduction to the study of experimental medicine that it's never to perform on human an experiment which might be harmful to him to any extent, even though the results might be highly advantageous to science. Louis Pasteur agonized over treating humans, even though he was confident of the result obtained from animal trials, and he finally did so when he was convinced that the death of a child appeared inevitable. By the beginning of the 20th century, it witnessed the start of large-scale clinical trials, which became the gold standard of evidence, as we know. The aim of this trial, guided with scientific method, was to collect systematic data on groups of individuals. In many instances, groups targeted for research included vulnerable population like prisoners, orphans, and mentally ill groups just because of convenience to the researcher. Such research persisted because essentially there was no formal codes of research ethics at that time. This continued until World War II, and the Nazi experiment on concentration camps ushered a new era in research ethics. It was discovered after World War II that prisoners were used in many experiments, including putting them into low-pressure tanks to see how long they could survive without oxygen, or to test how pilots would do after being ejected from planes. Many of those did not die immediately and were put underwater until died, and autopsies followed. After the World War II, the Nazi doctor trial occurred in 1947, and whereby doctors and scientists were put into the trial for murder. The trial took place in the city of Nuremberg, and when the judges issued their verdict, they issued also a section called Permissible Medical Experiment. This is considered as the Nuremberg Code of Ethics, which is the first research ethics code in history. This code contains 10 principles that serve to protect human rights and welfare when participating in research. The first and longest principle stated that the voluntary consent of human subject is necessary. Article 2 to 10 emphasize on the scientific value of the research, the favorable risk-benefits, and minimizing suffering, while Article 9 stated the subject has the right to withdraw at any time from the research. This was followed in 1964 by the Declaration of Helsinki, which was issued by the World Medical Association and was much related to physicians conducting research in a medical setting, and so focuses more on favorable risk-benefit ratio and the importance of independent review. The Declaration of Helsinki was also distinguished between research with therapeutic intent and research without therapeutic intent. The document was reviewed several times. And now, with two codes that guide the ethical conduct of research in humans, one expects that there should be no lapses, but that was not the case. In 1966, almost 20 years after the Nuremberg Code was issued, Henry Preacher, a scientist, published an article in the New England Journal of Medicine that included 22 examples of abuses of human subjects in medical research. This included withholding antibiotics from men with rheumatic fever, where 2 of them developed the disease and died. Other experiments involved purposely infecting institutionalized children with hepatitis, what we know now as the Willowbrook trial, and others. Preacher's article was significant in that it showed that abuses and exploitation of human research continues despite the existence of codes. At the same time, the famous Tuskegee trial came to note. The trial was conducted in a poor community of farmers with high prevalence of syphilis. The United States Public Health Services was trying to learn more about syphilis and thus withheld the treatment from a group of poor flag men who had the disease, causing endless pain and suffering. The research reported or exposed the study and was stopped, but many questions arise regarding abiding to codes of ethics in human subject research. And thus in 1974, in the United States, a National Research Act was passed by the Congress. This act produced national regulation that endorsed independent review of research by an independent review board. Now, if research involving humans is not reviewed by an independent review board, it's against the law. The Act also established the National Commission for Protection of Human Subjects of Biomedical and Behavioral Research, who issued the Belmont Report in 1979. The Belmont Report stated the ethical principles that now guides research practice, which are respect, beneficence, and justice. We're going to go through each of them. Respect requires that individuals to be treated as autonomous human beings and to be allowed to choose for themselves whether to enroll in research or not. Elements of autonomy includes both decision-making capacity and voluntariness. And decision-making capacity entails that the ability to understand the information, to appreciate the information, and the cognitive ability to process information and come to decision. While voluntariness should be, an individual should be free from coercive influences and undue inducement. The second principle in the Belmont Report, which is beneficence, entitles that at first we do no harm and to minimize the harms as much as possible, maximize the benefits, and as much as possible have a favorable risk-benefit ratio. The third principle is justice in a sense of fairness in distribution, and this requires that research should be designed so that its burdens and benefits are shared equitably among groups of population. That research should not burden a group to benefit another group. Also, there should be fairness in the selection of research subjects. For example, one should not select subjects based solely on their availability, easy availability, or their compromised position. For example, prisoners or individuals with mental illnesses. As a result of these strict regulations, some of the researchers started outsourcing their research or studies to areas with less strict regulation or even no regulation, and as a result, newspapers later reported some violations in low and middle income countries. For example, the Trovan case in Nigeria, where a company called Pfizer conducted a trial on a drug called Trovan during an outbreak of meningitis. Later, Pfizer was accused of conducting a trial without approval from a relevant local regulatory authority, and without ethical approval, and without informed consent. And actually, Pfizer researchers, they took advantage of the absence of functional ethical committee at that time in Nigeria, and the desperation of the affected poor illiterate people, and the emergency situation, which is an outbreak of meningitis that facilitated the recruitment of participants. As a result, Pfizer experiments was an illegal trial of an unregistered drug, and the Nigerian panel concluded that it was a clear case of exploitation. This led the Council of International Organization, together with the WHO, to issue an international ethical guidelines of biomedical research in human subjects, and that was very critical at that time to really show how these ethical principles should be guided in the conduct of research in low and middle income countries, taking into consideration the socio-economic circumstances, the cultural issues, the laws, the regulation, the administrative systems there, arrangements there, and now these science act as reference guidelines for many low-income countries, including Sudan. Soon after the science and WHO had issued their guidelines, the Federal Ministry of Health here in Sudan issued a decree to form National Health Research Ethics Committee, which is now responsible for protection of human subjects, including in research. This committee has produced their first guideline for ethical conduct of research involving human subjects in 2008, and that was further reviewed and amended in 2017 through a grant from the EPCTP. So we have guidelines for ethical conduct of research involving human subjects in Sudan as our own national guidelines. So comes the question, we have international guidelines, our own national guidelines. Comes the question, what really makes research ethical, and how investigators, research ethics committee members, sponsors, and other interested stakeholders determine whether a specific research protocol is ethical or not based on these guidelines. So we need a framework. Emmanuel and co-workers had suggested an ethic framework to review protocol based on the guidelines that govern human subject research, and they have put together 8 guidelines to provide systematic and coherent framework to determine whether research is ethical or not. These requirements are listed in chronological order, which are the value, the social and scientific value of the research, the scientific validity, the fair subject selection, favorable risk-benefit ratio, informed consent, respect for enrolled subject, independent review, and community perspective. We'll go through each of them briefly. To be ethical, scientific research must be valuable, which means it can result in scientific information that could lead to improvement in health and well-being of a population where it's being studied. Examples of valueless research includes one with non-generalizable results or research that has substantial or total overlap with proven results. Such research is called the Me Too research. For example, study that investigate previous results for the 6th or 5th time. This kind of research only enhances the promotion of someone's career by publication. And the justification of value as an ethical requirement is that valueless research wastes finite resources, and this includes putting human subjects at the inherent risk of research to produce nothing of value. The second requirement in the framework is scientific validity. Research must be conducted in a methodologically rigorous manner that is practically feasible. Even research with high social and scientific value can be rendered invalid because of poor design or conduction. Invalid research includes underpowered studies with unidentified endpoints, poor research tools, or poor statistical tests. Although many might argue that it's the responsibility of the scientific or technical committee to assess scientific validity, we know that studies that are not scientifically sound do not produce valid results, or they do not produce science. Again, there is use of resources and putting human research subject at the inherent risk of research to produce nothing, no science. The third requirement for approval of research is the selection or the equitable selection of subjects. Research should not unduly burden any segment of society with its inherited risk to benefit another group. So, research should not target vulnerable group or vulnerable person who are relatively incapable of protecting their own interests. More formally, they may have insufficient power, intelligence, education, resources, strengths, or other needed attributes to protect their own interests. So, research should avoid choosing groups based solely on easy availability or compromised position, and not involving groups unlikely to benefit from the subsequent application of research, and ensuring that the benefits and risks of research are distributed fairly among all groups in society. Clinical research, we know that it inherently entails uncertainty about the degree of risks. Accordingly, for clinical research to be ethical, there must be a favorable benefit-risk ratio. This involves several steps. First, one must identify the risks, and these risks must be minimized as much as possible by using procedures which are consistent with sound research design. Secondly, potential benefit from the research-related activity must be enhanced. Here we must only consider benefits from the research itself, not from added payments or added health services the subject might gain from participating in research. Thus, when IRB perform this risk-benefit analysis, they consider in one hand risk to participants, the risk of harm to participants, and on another hand, anticipated benefit, if any, from the research intervention itself, and the importance of the expected knowledge to be gained, and that's what we mean by favorable risk-benefit analysis. After satisfying the above four criteria, we came to the informed consent gaps. That is, if research does not have a social value, nor a scientific value, or not scientifically valid, with no fair subject selection or favorable risk-benefit ratio, it does not matter whether you have an informed consent or not. So, informed consent has to come after satisfying all the above criteria. The informed consent ensures that the individuals that are participating in research decides on themselves whether to enroll in research, whether the research fits their own values, interests, and goals. And research, of course, on individuals who cannot decide on themselves requires surrogate consent, so you have to find the nearest person to ask for the informed consent. The science guidelines has defined informed consent as a consent given by a competent individual who has all the information about the research and the procedures of the research, has proper decision-making capacity, including understanding and appreciation, cognitive abilities, and expression of the choice. An important thing is volunteerness. We're going to discuss informed consent in details in separate modules, but it's an important part of ethical research. After obtaining informed consent, respect of individuals does not end there. Actually, The ethical requirement of research does not end with the signed informed consent. So respect of enrolled subjects include permitting withdrawal of the research subject at any time without making that job very difficult to research participants. Also, it includes protecting the privacy of the research participant while you're taking information while the intervention is taking place, and also the confidentiality of the data afterwards. You have to ensure that the data will stay safe, especially confident data. Also, the research subjects have the right to be informed of the new risks and benefits of the procedure of any services. Also, informing them of the result of clinical research and maintaining their welfare during the experiment or the intervention, and that might include treatment of adverse effects. The seventh requirement is that the research has to be reviewed by an independent review board, which is the Research Ethics Committee. Since investigators have multiple legitimate interests, which include enhancement of health to society, advancement of their own career, and protection of rights and welfare of human subjects, these multiple interests can lead to potential conflict of interest that can promote the use of questionable scientific design and research conduct that puts the human subject at risk. That's why an independent review of research helps minimize these conflicts and helps really protect the rights and welfare of human subjects involved in research. To be independent, members of the Research Ethics Committee, or as it's called in other places, the Institutional Review Board, must be free from academic, political, and social influences that can affect their decision to protect human subjects involved in human subject research. The last requirement is the community enrollment, and that was added specifically for low and middle income countries. Since research to be ethical, it has to be responsive to the needs of the community. That is, research has to answer a question that leads to promotion of health or answering of a question that's specific to the community it's being studied on. Also, the research should involve the community in which it occurs, and it involving the community during the planning, conducting and overseeing the research activities. Also, research should assure or make sure that after the research is complete, that the results will be integrated into the whole system of the community being studied. This is the community involvement. So these are the 8 requirements that makes research ethical. Again, it's the values, the social and scientific value, the scientific validity, fair subject selection, favorable risk-benefit ratio, informed consent, respect for enrolled subject, independent review, and the community perspective. At the end, I would like to acknowledge the Middle Eastern Research Training Initiative and Professor Silberman for assisting us a lot in putting this presentation together. Thank you so much.